Hi, this is Pooja with Mom to Mom OB, where real women talk to real doctors about the issues concerning them. Today, this video is the second part of a series on childbirth. And for today's video, I'd like to talk about active labor. This is the real meat of labor. This is part of the first stage of labor. So we talked last time about the latent phase, which is the sort of pre-labor, and then the very beginning of the first stage of labor. The active part of the first stage of labor is what comes next. And so let's talk about that a little bit. So active labor is defined as painful regular contractions that produce cervical change. Most women enter active labor when they're around 6 centimeters, give or take a centimeter. And they progress from 6 centimeters until they are 10 centimeters or completely dilated. And that means all the cervix has sort of stretched away. The fetal head has caused the cervix to sort of stretch and allow for it to pass through. So active labor is painful. So when we talk about painful regular contractions, the contractions are intense. They feel like the very worst menstrual cramp you've ever felt. They can sort of start in your mid-abdomen and then sort of shoot down towards your lower back. And you can even sort of feel the pain into your vagina or kind of feel like it goes towards your groin. And that pain is regular, meaning that intense, sharp pain that lasts maybe a minute and then fades away, starts right back up again about 2-3 minutes later. And again, is intense. That sort of come and go is a really important quality of the contractions. And then the regular, every 2 minutes on the dot to have another contraction. And that physiology, that sort of rhythmic movement, you can think of sort of how a little centipede moves. That sort of rhythmic motion is what sort of propels the baby down through the uterus, through the cervix, and into the birth canal. And the very end of active labor is when you're completely dilated and you're in the second stage of labor, which is the part where you're pushing. So active labor, again, part of the first stage of labor. It is relatively passive on the mother's standpoint, but the uterus is doing all the work. I'd like to talk a little bit about some of the variability from one mom to the other in terms of how their active labor progresses. We've all seen the movies about women who, spontaneously go into labor and barely make it to the hospital in time to have their baby. And that's not usually the case. It can be fast, but for most women, the active part of labor takes hours. Every centimeter that your cervix is dilating, stretching to accommodate that fetal head can take an hour or longer. We don't, as obstetricians, categorize the labor as being abnormal, or we don't say that there's a labor dystocia, which is the word that we use and that you might hear, unless it takes 4 or even 6 hours for cervical dilation to occur. So you could be at 5 or 6 or 7 centimeters for a long time. And the process of going from 5 or 6 centimeters to complete and pushing could take most of the day, and that would be okay. And so I think setting expectations about the active phase of labor is really important. We talked earlier about the latent phase of labor taking days. Well, the active phase of labor can be really fast, but it could also take the whole day, and that would be okay too. And then the other thing I want to talk about are some of the potential hiccups that you might encounter during the active phase of labor. So during the active phase of labor, we, in the hospital, typically we would encourage women during that point in their labor to come on into the hospital, and we would typically monitor the babies during that period. And so we would have a monitor on the maternal abdomen that was recording the baby's heart rate. And we look for patterns that show us that the baby's getting the oxygen, the blood volume, the all the support that it needs during the birth process. And so we're watching that baby's rhythm, just like we might watch mother's heart rate and oxygen saturation and all those different measures that indicate that her health and well-being is where we want it to be. And so you may find that during the active phase of your labor that the baby has episodes where the heart rate becomes slower and then becomes more rapid. And, all of those are classified in a system that we use. It's a categorizing system, 1 through 3, that we use to sort of denote the quality of strip that the baby's displaying. And so if it becomes persistently concerning, that category 2 or 3, and your obstetrician says, this isn't working, the baby's not tolerating labor, it's indicating that it's not getting the support that it needs, then that could be a reason why you might be recommended for a C-section. And so it's important to understand why these monitors are in place, what they're recording, and why people like your OBGYN or your nurse midwife might be making the recommendations that he or she is making. And so again, fetal monitoring is all about ensuring that the baby is getting the support it needs during the labor process. And then finally, something else that's really important to talk about is pain control options. So everyone has seen images or heard stories about women screaming in labor, just out of control, wild animal, just primal, painful experiences. And I just want to provide some reassurance that while, the active phase of labor is categorized as having painful regular contractions, those aren't necessary. There are a million different options for pain control, from different varieties of IV pain control that have relatively short lengths of activity where your body clears them rapidly so you don't have as many of the negative effects, especially the respiratory depression that some more long-term opioids can cause for the baby. And so these very short-acting IV narcotics like fentanyl, Stadol, even morphine are available during the active stage of labor. Then the other option is an epidural. And many of you may have heard of your mothers or aunties having positive or potentially negative experiences with epidurals. And many of the wives' tales that we've heard or that are part of sort of urban lore about the chronic back pain and difficulties women had with their epidurals, a lot of that is not really evidence-based information, at least not the way that the epidurals are administered now. Epidurals overall are very safe and provide excellent anesthesia. So good that if a patient has a complication during their labor and ends up going for C-section, they can actually have the dose adjusted and provide adequate pain relief through the surgery. So you can imagine just how effective these pain management options are if you could use them for surgery. So epidurals are a great option, and your anesthesiologist who's available on labor and delivery can go into all the details about the risks and benefits with you. And of course, if you have some particular concern about that and want more information, you can always schedule a consultation with an anesthesiologist before your labor, so you can get all of those questions answered. But overall, a great option for many women. And, you don't have to be, going the all natural route and experiencing that pain if you don't want to. Another misconception is that, having pain management will slow down your labor. And that's not true. On average, an epidural may, change your length of labor plus or minus an hour. And so as we've already discussed, the incredible variability from one woman to the other, with labor taking several hours to days, that plus or minus an hour really isn't a significant effect as far as lengthening your labor. So that's everything for this episode regarding the active phase of labor. Stay tuned for the next part of this series where we talk about the second stage of labor. And again, if you have any questions or comments, leave them below. I'll try to get to all of them. And I look forward to talking to you soon. Thanks.